I suspect that this vlog will rather benefit from becoming 2 vlogs. Because I think otherwise I'm going to have to cut an awful lot out. Because when I start rambling, I ramble, as we all know. So, this is going to be part 1, in which I talk about my thyroid condition, my mental health issues, and my arthritis and joint issues. And then in part 2, I'm going to focus on perimenopause, because that really is the biggest topic. I think it's the one that I'm most interested in right now. My thyroid I have lived with for so many years, and my joint pain and my depression I've lived with for so many years that I suppose they're not as exciting at the moment as the perimenopause symptoms are. So that's what I'm going to do. Keep watching this one for those first few parts. Life with an overactive thyroid, depression and anxiety disorder, and osteoarthritis. Yay! Fun! And then in part 2, which I will post at the same time, I will edit both of them at the same time, you're going to hear me talk about perimenopause and how my perimenopausal symptoms fit into all of my other symptoms, but why I think that they might be separate.
When you've finished recording, hang up or press the hash key for more options.
Oh, hello there, good morning. My name is Tova. I'm due a thyroid blood test and I don't have any blood test papers at home, so I was calling up hoping we could sort one out. Many thanks for your help. Thank you, bye. Hi, welcome to the vlog. I am just about to I really am. Just about to drive off to my GP surgery and go and have my smear test done, because, ladies, we need to regularly have our smear tests done, okay? We don't want to end up with cervical cancer. That's a bad idea. Good thing to check it and make sure that we catch it early. So that's what I'm doing now. And the message I just left was for my endocrinologist, because I need to go and do a new blood test screen for my thyroid. I live with an overactive thyroid and it has to be checked regularly. I'm going to do a vlog about my health for once. Not Elin's health, my health. Special needs mama, medical mama, who cares for the carer, right? So in this vlog, I'm going to talk about my thyroid condition, I'm going to talk about my mental health, I'm going to talk about my arthritis and joint issues, and I'm going to talk a little bit about perimenopause, just a little bit, because there's the topic is this big and there's a lot more to come on that. And how all of these actually interact with each other and interconnect with each other. But yeah, I thought it could be interesting for me to spend a little bit of time thinking about me. Any of you who is watching who is a carer know this exact thought. What, me? What about me? No, I have other people to look after. But also that there are so many out there who are in my situation. You are women, mums, carers, doing it completely on your own or almost on your own, and it's so easy to forget yourself. And I'm not talking about the self-care bandwagon here. I'm sure one of you will itch to write, "You can't pour from an empty cup," and just so you know, that particular phrase makes me see red. I really have an issue with the self-care movement of, you have to look after yourself. Geez, when am I going to do that? My to-do list is already too long. You've just given me another impossible chore. But how I see this issue and topic of self-care and how I approach it, and hopefully offer a little bit of a different perspective to it. So that's what I'm going to do, but not right now, because right now I need to get my little butt into the car and drive off and do a little bit of intimate health screening. Always a good thing to do those things. I'll catch you in a moment. All right, I'm back from my smear test, and look at that. How cute is she? This is something she did so much when I got her. She's like, I want to lie near you, I want to be in the same room, but I'm not going to be on you. But she likes hanging nearby and now she's smiling at me. I love my cat. Yes, back from my smear test. Feeling a bit, So now I'm having coffee and a snack. Smear test experience was, well, it's a smear test. Our nurses are usually, I'm going to say, I have never had a bad experience. So yes, our nurses are usually very, very good at making that as not uncomfortable as is possible. Because you're lying down, your legs are apart and somebody's shoving a speculum up your vagina and having a dig around in there. I mean, it's not like our favourite experience, is it? But it's something we need to do. It is the best way to discover precancerous and cancerous cells and saving lives for women. So yes, there. And while I was there, I knew that I wanted to ask her about breast cancer screening, and she also had on her checklist of things to do to ask me if I check my own breasts. So in the UK, I found out now they start NHS screening for breast cancer when you're 50, so I've got another 4 years. In Sweden, it's when you're 40, I believe, so I was a little bit unsure. Obviously knew that I hadn't been called in, and if you're any good at maths, you now know I'm 46. But yes, I do feel through my breasts regularly, checking for lumps, checking for sore areas, because again, it is the quickest and easiest way to discover early if you have any worrying changes going on in your breasts. So do it. Have a look. Don't be afraid if you discover a lump. The vast majority of lumps are completely benign. They're not even tumours. It's a cyst of some sort. It's a fatty accumulation of some sort. Like, it's nothing to worry about, but have a good feel through and make sure you look for things. Make sure you look for dimples in your skin as well, or miscoloration of your nipples, miscolorations of your skin on your breasts. Really important things to do, and just, saving lives. Okay, so I gave you a brief little rundown of the health issues I was going to cover at the start of this vlog. Since then, I've remembered one more, which is really minor, so I'm going to start with that one, and that is I have something called Horner syndrome, Horner syndrome. What that is damage somewhere along the nerve that controls how open your eyelid is and how big your pupil is. And I believe it is right side Horner, but I might be wrong. That basically I have one, it's so minor that I don't even know which side it's on, okay? I have one eye where my eyelid is marginally droopier than the other eye, and where my pupil is marginally smaller than the other eye. And I've had an MRI for this just to make sure that there was no tumour anywhere along that nerve. This is a weird nerve because between the start and the finish point of this nerve, it's about that far, about 1.5 inches, but the nerve goes from your brain and then through your entire torso and then back up to your brain. So it's super long. It's like this weird thing that's happened over evolution. So it's actually quite common to have damage somewhere along that nerve. I don't have any tumours. The likelihood is, and this is me and the doctor guessing, is that, the doctor says that there is old trauma to the nerve. So we're guessing this is from a bicycle accident I had when I was 10. The way I discovered it, though, is such a special needs mom thing. I was sitting on the train on my way to work one morning, putting on my makeup and going, why is my pupil twice the size as the other one? And I called the 111, the UK NHS telephone service. And they basically said, do not panic, but please make your way to Moorfield Eye Hospital Emergency Department. And so they were looking at me and they were investigating and they were trying to work out what was going on, and they couldn't find out what, and they were running all kinds of diagnostics. And one of the things they tried was an eye drop that is solely for use of discovering Horner syndrome, and went, oh my God, you've got Horner syndrome. Which was so weird because Horner syndrome is a smaller pupil, but my pupil was bigger. I have since worked out what it is. And that is that Elin has a medication called a hyoscine patch, scopoderm, and it's a little plaster that we put at the back of her ear, and it is originally, it's a motion sickness medication, but it dries out your mouth, and that's why we use it with Elin, because Elin dribbles so much. So for her, it's It's sort of to control her saliva production. Now, the active ingredient in a hyoscine patch is the same active ingredient that the optician uses in the drops that dilate your pupils when they're doing an eye examination. So if you take this patch off yourself or your child, you accidentally touch the side of it with the active ingredient, also the sticky side, and then accidentally touch your eye, you're going to dilate your own pupil. That's what I did. And that's how that was discovered. And I mean, I can live with Horner syndrome. It's like, it's not going to have any effect on me. It doesn't affect my vision or anything like that. And as I said, it's not caused by a tumour, so we're good. But yes, special needs mum, ailment. Simply because I hadn't washed my hand after changing Elin's medicine patch. Yeah, there we are. Cheers to that one. I live with an endocrine disorder called recurring thyrotoxicosis. I have an overactive thyroid, hyperthyroidism, ER. The thyroid is a little gland in your neck. It's part of your hormonal system, your endocrine system, and it controls your metabolism, so how quickly you burn energy. And because mine is overactive, hyper, it means that when my thyroid is not controlled, it is controlled with medication, but when my thyroid is not controlled, my metabolism runs away with me. I lose weight extremely fast, I get very hyper, I get palpitations, I get dizzy spells, I get anxiety and nervousness, and tremors. I start trembling. My diagnosis is recurring thyrotoxicosis. Basically, my thyroid becomes toxic on me regularly. It comes back, recurring. So I have had this happening to me 3 times in my life, and the 3rd time was after Elin's birth, and I have been medicating since. We have not attempted to get me off medication because as it was the 3rd time, we know it's recurring. We know that if I stop medicating, my body might stay stable by itself for a while, but it will come back. The preferred treatment for this is radiotherapy to remove the thyroid. But I have 2 fairly young children, one with severe needs. So my endocrinologist doesn't want to make me radioactive for 2 weeks right now. She thinks that maybe that's a little contraindicated. And I'm perfectly happy with this because if we kill off my thyroid with radiotherapy, then I'm going to be hypothyroid for the rest of my life, which is an underactive thyroid, and I'm going to have to medicate for that for the rest of my life. Swings and roundabouts. There are side effects and benefits of both treatments. In the long run, I'm going to have to face up to losing my thyroid because that's just how it is treated. But for the foreseeable, I am perfectly happy to stay on my medicine, which is carbimazole. I take a 5 milligram tablet every 48 hours, every other day. So I'm on the lowest possible effective dose and it keeps me level. And I'm happy to do that for now. As I say, there are side effects of that. One of them being that it can really mess up your white blood cell production. So if you get severe flu symptoms, you need to go and do a blood test and make sure that you actually have an immune system. I have never had that problem, and I've even had COVID during this time. I think I've had COVID twice, but the first time was before COVID was officially in this country. But oh my God, I was sick. So I've had severe flu whilst being on carbimazole, and it's not been that my immune system's given up on me. Being hyperthyroid is less common than being hypothyroid. A hypothyroid or hypothyroidism is an underactive thyroid. It's actually really quite common amongst women my age. Again, 46. So middle-aged women, perimenopausal women, it's very, very common to be hypo, to have an underactive thyroid. They're wondering why they can't lose weight. They're wondering where their energy's gone. Now, Hypothyroidism, much more common. There's loads of information out there. So if you do have questions, you are wondering about your thyroid, if you think you might be hypo, go online, have a look. There's loads. I mean, the same if you suspect that you might be hyper. Again, there is loads of information out there, but as an ailment, it is less common and it's less talked about. And I'm actually going to come back to the thyroid issues when I talk about perimenopause in a moment as well, because there's such an overlap. With a hyperthyroid, digestive issues are very common, and basically because my metabolism naturally is quite high, quite fast, everything runs through very fast as well. And then we don't need to go more graphic than that. It causes weight issues. I struggle to keep weight on. And if you've been following me for a while, then you can tell by looking at me that I have lost so much weight. And I'm not happy about it. I don't know how much it is in kilos or pounds or whatever. My bathroom scales are broken and I cannot be bothered. But yes, I've lost a lot of weight. And I did that while I went through that very severe period of depression, followed by being very, very poor and not being able to afford food. Might have had something to do with it. But yes, losing weight is much easier for me than gaining weight. And I do get people who go, "Oh, it sounds amazing! Lucky you! Can I have some of that?" And because I am the very, very pragmatic and also slightly mean person that I can be at times, my response is, yeah, well, you know, I'm going to die young of a heart attack with every bone in my body broken due to osteoporosis, but at least I'll be a thin corpse. Irony is a lovely thing. Yeah, so those are the risk factors of living with an overactive thyroid, is that it puts a lot of strain on your heart. It causes osteoporosis and can lead to early death. As I manage my thyroidism, you know, I don't think I need to worry overly much about those things, and I have an amazing endocrinologist. I can say this. But I suppose what I'm saying is, if you suspect you have an overactive thyroid, don't wait, go and see a doctor. There are simple tests that can be done for it and you'll get an answer. Again, if you've followed me for a long time, you know that I'm really open about my mental health. A couple of years ago, I burnt out and I went through a really bad burnout depression. Every winter, I suffer from winter depressions. So last winter was pretty tough because I'd had a burnout depression that put me down here, and then I sort of recovered to about here, and then I got a winter depression which pushed me down to here again. And I really want to come up to here somewhere, and I'm not there yet, but you can't expect to recover from severe depression just like that. It takes time. And there's a lot of, just, girl, give yourself some grace, okay? And with my depression comes a lot of anxiety. And this anxiety, it makes me very tired because it takes a lot more energy to go out and do things than it would if I didn't have that anxiety. So I've been to my GP surgery, I've had a smear test done, I've come home. I actually want to go to bed. And it's not even that I'm tired and want a nap, it's that I literally want to pull my duvet over my head and not have to face the world. So it's a mental fatigue that comes with that anxiety. But yes, loads more about my mental health on previous videos, so have a look at those. I believe I have a playlist called Mental Health for Special Needs Parents, where you will find most or all of them, or if it's even Health for Special Needs Parents, I can't remember now. We're going to come back to that symptom when I'm talking about perimenopause. Oh my god, forgetfulness. What else do I have? I have osteoarthritis and very bad joints. Hurrah! I have osteoarthritis in my hands. So if you've ever seen me with my hands taped or seen me wearing a wrist support in my vlogs, it is to give my hands a bit of extra support because they hurt. And they don't function as I want them to. I also have poor joints. I have chronic tendonitis. I basically have an equivalent of tennis elbow, particularly in my left arm, and I call it Elin elbow because it is a repetitive strain injury that comes from looking after my complex needs child. With Elin, there's a lot of rotating moves that I need to do in my day-to-day care with her, of dressing her, of changing her pad, of doing her physiotherapy, of positioning her. So repetitive strain injury, and I get tendonitis, so tendon inflammations flaring up in my arms on top of the osteoarthritis, and sometimes my hips really hurt and sometimes my knees really hurt, and I'm basically creaking and I feel very old. I know I don't look old. Actually, I got ID'd in the shop 2 days ago. Not my shop, obviously, a different shop. Yes. Can I see some ID? Yeah. Mm-hmm. Cool. Yeah, you can. Absolutely. Why not? It's beyond a joke now. So I don't look it, but I feel it. Maybe I'm super old on the inside and I look youthful. It's like some sort of weird Dorian Gray's portrait. The outside is beautiful, the inside is just falling apart. And of course, having joint pain and arthritis issues when you have a child like Elin, it's even more difficult. I experimented with, what's it called? Oh, anti-inflammatory herb, turmeric. I experimented with turmeric a while back, and I actually think it helped, but I used both turmeric and CBD oil, so I want to test them separately. But yeah, I actually think the turmeric helped, and I really would like to go back on it, but it costs money that I don't really feel like I have at the moment. And then we're back to this whole thing of who cares for the carer, who's looking after number one, should I be spending 15 quid on myself every month for the sake of being in less pain? Yes, I really probably should actually, but it's also, it takes energy to order it online, and it takes even more energy to go to Holland and Barrett to buy it. That's my excuse, and I'm sticking to it. But I should. And if I do, I will come back and do an update on how I find it. And if I'll just try turmeric this time separately and just see if there's any difference. Thank you so much for watching this first part of my health. Of my health. I hope you enjoyed it. As always, if you have thoughts or comments or questions, then post them in the comment field below. I'm always very interested in reading them, even if I don't always reply. I do read your comments. And head on over to part 2 of my health, which is all about perimenopause. I'll see you there. Bye.